Well, welcome and thank you for attending the Cool Cleveland Editorial Board meeting. Today is September 26, 2013, and we are in the beautiful art gallery of the historic Old Stone Church on Public Square in beautiful downtown Cleveland. Joining us today to discuss issue 1 are Judge Ellen Connally and Cuyahoga County Councilman Dan Brady. Thank you so much for being here.
And I'm here as County Council President.
As County Council President as well, that's right.
But I'm not a judge anymore. I want to make that clear because there's been some rulings of the Supreme Court. So you're not supposed to hold yourself out as a judge if you are no longer a judge.
So you're no longer a judge,
right.
but you are Cuyahoga County Council President.
Right, I'm elected to the legislative branch.
I thought you kind of kept whatever.
Well, traditionally it has been, but the Supreme Court came out with a ruling about people using the title, so I'd rather be safe than sorry. Yeah.
Okay.
RAG.
So we are reserving the first 10 of our 30 minutes to hear from you in support of issue 1. And we'll use the remaining 20 minutes for our Q&A with our editorial board. This session will be videotaped and posted to coolcleveland.com to allow our readers a better chance to understand the issues and candidates as they prepare to vote in the upcoming November 5th general election. We will use this session to help us prepare our editorials and our endorsements. Now I'd like to read the language that will be on the ballot for issue 1. For the County of Cuyahoga, it's a proposed tax levy, it's a replacement and an increase. A majority affirmative vote is necessary for passage, a replacement of the 2.9 mills of an existing levy and an increase of 1 mill to constitute a tax for the benefit of Cuyahoga County for the purpose of supplementing general fund appropriations for health and human or social services at a rate not exceeding 3.9 mills for each $1 evaluation, which amounts to 39 cents for each $100 evaluation for 5 years, commencing in 2013, first due in calendar year 2014. I'm Thomas Mulready, publisher of coolcleveland.com, and I'm joined today by our writers and editors who provide regular coverage of civic affairs and politics each week in Cool Cleveland. Mansfield Frazier, Richey Piiparinen, who will join us, he's on a call, Anastasia, Pantsios, and Larry Durston. So we'd like to invite you to spend 10 minutes or so explaining why we should endorse and why the community should support issue 1.
Okay. With the Council President's permission, I'm Dan Brady. I'm the Vice President of the County Council and the Chairman of the Health and Human Services Committee. I think it's important to understand the background of this, to understand how we got to where we are. The Council began as late as last December to try to take a serious look, and that would be the Finance Committee, which both of us sat on, to take a serious look at the future finances of the county. We had known, I guess, since the day we walked in the door, because of the economy, that the reappraisal of property in the county would probably result in a much reduced amount than it had before. But we didn't know exactly what number. Numbers were projected, but they weren't exact enough for us to make any deliberations over at that time, particularly since we're still trying to figure out how to work the desk and how to run the meetings and who to appoint to committees and trying to set up the foundation of the new government. When we did begin to, after the reappraisal, when we began to get the numbers in, we found out that the county is actually in a significant amount of trouble in some ways. We have a significant budget surplus in the general fund. A lot of that is due to efficiencies the county executive has implemented over the last 2 years. But the Health and Human Service budget, which is a separate budget, and about half the county's budget, a lot of it made up by federal matching money and some state money as well, would be down very significantly in fact down about $22.5 million next year, and of course $22.5 million the following year. Now, one of the things we did when we came in was we decided to go to a biennial budget, like in the legislature, because in a lot of ways the county is a creature of the state. In many ways, state law is really county law. We have a charter, and we are able to have more flexibility and autonomy. But in the past, the county always had annual budgets, so we have a biennial budget. So we were faced with about a $55 million projected loss in health and human service funds going into the biennial budget of this year. The administration made presentations before us in the early part of the year, and their presentation consisted of spending down some of the surplus, which would have been appropriate, and that's what surpluses are for. But it still left about $12 to $13 million unaccounted for, and with no precise explanation of how that would be made up for. And that would be around $25 million, $26 million over the biennial budget. So we had several meetings, and we're trying to determine what to do. Some members were pretty aggressive about wanting more information from the administration about what their plans would be, and I'm certain there were different opinions about how we would approach this. I'm sure some of the conservative members assumed that it would be approached by making serious cuts in health and human services. The idea of asking for what is essentially a tax increase was something that was not entertained by some members. The discussion moved into the Health and Human Service Committee after it had sort of exhausted itself in the Finance Committee. And we began to deliberate very seriously in early April and through the month of April and May about what we should do. The charter gives the authority to the county council to place some levies on the ballot, including a levy like this one. In the past, it would have been 2 commissioners, and I think a lot of people just sort of assume that that's the prerogative of the executive. It is, in fact, not the prerogative of the executive. It's the prerogative of the county council. And I was in consultation with the county executive continuously through this period. I had 2 different groups working on how we might approach the issue, and had indicated to the executive, and these were very good discussions, that I would come to him at the beginning of June and tell him what we thought we should do, and that's what we did. So we discussed it, and it was determined that the council would lead this effort and go forward. And so we began to have hearings and try to see what people thought. Brought a lot of people in, and it's important to understand that in order for the council to put a levy on the ballot under the new charter, it needs a supermajority. So instead of 2 commissioners, it would be 8 councilmen. With 11 different personalities, that's a lot harder to get to than you might imagine. I suppose it's meant to be hard to get to. And we were hovering around 7 members for quite a while. Couldn't quite, get to 8. Make a long story short, we got to 8, and we got to 9, and we got to 10, and we finally unanimously passed the legislation to ask the people, go to the ballot and ask the people, in the words of one of the most conservative members of the council, he was willing to vote to allow the people to have the opportunity to make the decision, even though he personally wasn't sure it was the right decision. So that vote was taken in late July, and we have been working very hard since then. We did polling, we hired consultants, we've been scrambling, we've been raising funds, doing all the things you need to do to put a campaign together. We kicked it off last week with the county executive there and people from the broad coalition that we've been able to build so far. We have less than 6 weeks to go to try to convince the people of Cuyahoga County that this money is much needed and that programs that are very important to them will suffer serious cuts. And very soon, if this levy is not passed, we were fortunate that we drew the number 1. So it's vote on 1, which is very high up on a very long ballot. That is pure luck, I have to admit. And we're happy for that break. So that's what we're doing. We're spreading out all over the county. We're putting together all the components that make up a good county-wide campaign, and obviously it's a very big county. And I'm leading that effort in the county council. I felt as the chairman of the Health and Human Service Committee that I couldn't stand back and not do something about the fact that we were faced with having really lowered standards that are been part of Cuyahoga County's culture for a long time. We're proud of what we do here at Cuyahoga County, and we don't want to have those standards decline. Doesn't do us much good to have a new reformed government if we don't deliver services, at least at the level that we have in the past, in my opinion.
Thank you. Just to kind of tag off of the political background that you've just given, was there consideration as to what the approach would be if either the council decided not to go to the community for a levy, or if this levy goes and fails? Is there some fallback plan? Was this the plan from more conservative members, as you put it, from the beginning, that you would have to cut back services? What would happen if this doesn't fail?
Well, if it fails, we're going to have to cut services. That's
Specifically, what
well,
would
you know,
people
the
see?
county provides such a wide variety of services, and these are services that, 200 years ago provided by churches and private institutions. So one of the major functions of the county is to provide, for the poor, for the homeless, and all kinds of a variety of services. From Metro Hospital, from facility programs for juveniles. We have an aging population. We have many people in mental health issues, and one of our largest mental health facilities is actually the county jail, where people are there. Sometimes, as a judge, I used to send people to jail because they had no place else to go. So these are programs that help a wide variety of the community. And as I see it, these are programs that assist people now that will save us down the road. So if we have programs for juveniles, we have program early intervention for mental health and drug programs, then we're not paying down the line when that person is either incarcerated or has more serious problems. So these are the kinds of programs. We have after-school programs, we have daycare programs, mental health facilities, adoption services, drug treatment programs, the whole gamut of social services that are supported by the county. And we also had cuts from the state, which also, but if we don't have this passed, there will be definite cuts to services at Metro Hospital, which is the primary care facility for many people in the community.
Mm-hmm. Anastasia, do you want to?
Yeah, why, you said that there would be you projected a deficit of about 22 million. and you're going for an increase that will bring in 32 million. Why are you going for this much of an increase, and also why is it a replacement levy rather than a renewal levy? Because I'm so confused about this, and this is probably the way our governor and legislature wanted it. But as I understood it, a renewal levy was not subject to the 12.5 rollback, but a replacement levy is.
Actually, I mean, it's a good
And that
question.
state rollback is also going to cost us a lot, and we're also looking at this this ceiling that they've now put on a homestead exemption for
Those
seniors.
are lots of questions.
Which is really, really low, and I was on the conference call with Ed Fitzgerald and State Representatives James Lee and Barbara the other day. And the state representative said they think it is being levied on, that is being decided by gross income, not by taxable income, which is really terrifying.
Well, I think.
Because it seems to me like you're putting all this increase on the backs of possibly seniors who would then need your services as a result.
You know, sometimes there are no good choices. And one of the things that you just said about state representatives saying that they thought that, we've gotten an awful lot of they think that in the last few months. For instance, it was not until the middle of the summer that the state decided that, in breaking with, as long as anyone can remember, that they were no longer going to pay 12.5% of the levy.
It's actually 42 years.
Okay, well, as long as anybody can remember,
Yeah.
you know, that would include most people. This was not something that we expected. It's certainly not something we welcomed. And there are people who have introduced legislation. There are people who are fighting to get us at least grandfathered in for this fall. We're not counting on that to happen. And I'll tell you, the politics of that are quite simple. The politics of it are that, you know, we're one of the only counties that has a health and human service levy. These big metropolitan communities, like Franklin County and Cuyahoga County, for instance, have a lot of different types of needs than you know, some of the other 88 rural counties. Many of the other 88 rural counties don't have any levies at all. They'll have a school district will have a levy on it, but not a levy that involves health, human services, or mental health, or senior services, or like a lot of other big municipal communities around the country. And so legislators from smaller rural communities that don't have levies don't want to help pay for our levy. Well, on some level, that's understandable, but you know, we represent a significant amount of the population. We have significant needs that are different from counties that have 15 or 20,000 people in them, and so this was a real, you know, kick in the teeth for people who have been planning levies for the entire year in big municipal areas, not to have this additional information available. So we certainly regret that, wish it wasn't the case, but that's the situation we're in. And I would rather ask people, I would rather go ahead, although we were so far along the process, I don't know what else we would have done. I would rather go ahead and ask people to dig deeper, which I know is difficult, than to face the possibilities of these cuts. I'm not going to preside over a new county government that does not deliver the services to the people in this community that we did in the past. Otherwise, I don't see what we've accomplished.
So why are you asking for so much more than what you projected as the deficit?
Well, it's we asked for a 1 mil levy, and the fact is that we believe that you don't really get so many opportunities to ask for an increase. So if I'm going to ask you for 5 cents today and 5 cents tomorrow, you know, I'd rather ask you for 10 cents today. But beyond that, a lot of us believe there are needs that are unmet in this county currently, particularly in the area of mental health. And there is a majority of the members of this council who believe in the area of mental health and also alcohol and drug addiction services, as well as staffing levels of our basic services, that there are needs that are unmet. And we have a bit of a little budget battle 2 years ago over that. So yes, we're trying to be sure that we don't have to make cuts, and if we've got a little left over to do a little more, then I would hope that the majority of council would see fit to do that.
And I just like to say there are some real issues with staffing levels in this area. We have a tremendous turnover of people, social workers, because they just get burned out. Then we have the growing problem of overdoses. We used to run like 40, 50 overdoses a year from heroin addiction. Now we're maybe running as high as 300. And these are not inner city problems. These are problems in the suburbs, primarily white males, 18 to 40 or so. So that's really one we've got to address. We also have the problem of people coming to our county from some of the rural counties just because we have services, and of course we have the highest number of people of reentry. And I haven't mentioned that reentry services is something that we need to continue to support and increase. There's just, and I keep going back that we have an aging population. I just looked at statistical data from the census. These people are going to need services. All the people who, moved away and left their parents here, we got to, help take care of them also. But our staffing levels really continue to concern me that the administration has chosen not to fill positions, and it results in a tremendous amount of turnover. But I also have a good story to tell. I had a friend that was a senior citizen, or is a senior citizen, and had some people, kind of rip them off. It's like the people called Senior Adult Protective Services, and they did a wonderful job. And they came in and helped. I mean, just the kind of thing that need, because this gentleman had really no family, and they came in and really marshaled his assets and got a guardian appointing for him. So there's some success stories out there. So these are the kind of services that we need.
I believe, for instance, that the Adams Board, which would give some $36 million to annually, needs more money in order to take care of the problems of the people of this community. Also, we're lucky to have one of the only large public hospitals. Public hospitals are almost a thing of the past. We're able to serve, tens of thousands of people who couldn't get their insurance, couldn't get services any other way except to show up at an emergency room somewhere through Metro Health. And we subsidize Metro Health, not as much as we should. We subsidize Metro Health to some $30-some million a year as well. Now,
is the Affordable Care Act going to impact that?
That's just where I was going, thank you. The affordable health care, if it's implemented, would be very helpful. And in fact, in a very big way. That is to say, Metro applied for the ability to draw down on the Affordable Health Care Act very early, one of the first in the country. The state of California and Metro Health, 2 of the 3.
Now by drawing down.
Well, being able to draw down on as a public institution, if we give Metro Health, let's say $35 million, they can draw down $2 from the federal government for every dollar we give them. We can pull down $70 million more for the care of the poorest people in this community through the Affordable Health Care Act, because we have a public hospital. Private hospitals can't do that, and there aren't that many public hospitals left. And so, this is very important to our ability to make Metro Health Care, make Metro Health more effective for the underclass and the poorest in our community.
So give a big picture of how the big pieces are shifting here with affordable health care, with our demographics and our aging population, with the new county government. All these are moving pieces of the puzzle here. And it's a concern that we don't quite have it together. We don't quite have it figured out. We're not ahead of the curve. We're kind of behind the curve. put it all together for me, if you would. Where do you see it as you discuss things on the county council in terms of how these services are going to be met in the future? Because continued tax increases are not sustainable, regardless of what your politics are. We all know that. So how does it play out in the long run? Where are we headed? We understand where you are today with this, but where are we headed after the next couple of years?
Well, in my opinion, what was not sustainable was not doing something about the problem that was facing us. We could have drawn down on every single surplus and every single penny and laid off every single person we could possibly find to lay off and cut and cut, and we would have still been in trouble in a very big way. Within 2 years from now, we'd be back here doing something, either the same thing and playing catch up, or we would be doing something even more drastic. So I guess I would turn it around. I think we could have been behind the ball. I think that because of what we're trying to do, we're not going to be behind the ball. I mean, we hope that real estate levels raise, real estate values raise. We can't depend on that. We can't measure it. But everybody hopes for it. Most people believe it. We know that tax increases are not, continued tax increases are not sustainable. You won't see me back there asking for another tax increase. But this one we need, and we need it now because we can begin to draw money in January. And believe me, there were different voices that either wanted to. There was not a consensus for even going for an increase next spring, which would have been a normal cycle for the renewal. And there were voices that we would go for an increase possibly in 16, which wouldn't have brought in any more money until 17. At that point, we would have been hundreds of millions of dollars behind the 8 ball. And I don't know what condition our county would have been in. Now, just in terms of the county government, I'd say that you have to consider it's a work in progress. I mean, it's a big job setting up a county government, a lot harder than writing a charter.
But I think that you have also that you have people on this council that are extremely conscientious, that we are going over figures, expenditures, when any program comes in and asks for, adds for a budget item, we're asking them questions: who do you serve? How many do you serve? Is it spread throughout the county? And I've been really impressed with some of the programs that they've come in. One particular program I'm impressed with, they have a program for juveniles. Rather than just locking up juveniles, they have essentially, it's a daycare program. They pick them up at their house by 8 o'clock in the morning, and they have the kids there until about 8 o'clock at night. And so we save housing them overnight. The child's still involved in the community, but they also have this intensive daycare program. That's a pilot program they're working on now to keep these children out of the juvenile facilities. And they have to get complete cooperation of the parents and make sure they're not, climbing out windows at night and stuff. But I mean, that's been very, very successful. So, we have to trend in a new direction, but we also have to take care of the problems that we have.
What will happen if this governor gets reelected? We already know we have a legislature that is not friendly to this because of its overwhelming domination by, as you mentioned, people from these rural counties that may have different problems. And it's really clear that their priorities are simply not with the normal governing function of providing services to average people, and there are continued cuts. I mean, what then?
Urban areas will suffer.
Just to note, we have about 2 minutes left, so.
And these people are going to have to realize that these urban problems are moving into their communities also. They're no longer completely isolated. These meth labs and a lot of these things are in rural areas, not necessarily. And as I told you before about these heroin overdoses, these are not in the inner city. These are all out in the suburbs. They're moving out to the smaller counties.
If this fails, what would you do? Would you go for a renewal next year, or?
We
I don't
talk
think we
about
can
that.
predict. We can't predict what we would do, but we've got
But you would
5
have
weeks to
other
avoid
options.
that. There are always other options because there have to be. So of course we'll do whatever we need to do in the future, but we're determined to be successful this November and avoid that discussion.
So about one more minute, I don't know if there's anything that we've left out that you want to...
I just want the taxpayers, the voters to understand that we didn't just willy-nilly make this decision. We looked at some very, very serious consequences, and our concerns about the community, and Dan and I both have a long track record of being concerned about these kind of human service issues, and we would not certainly come in here like, this is money that's needed for this community, particularly in the area of mental health. This is not a class or regional problem. This is a problem throughout the entire community. I think everybody that you know has someone that in their family or circle of friends have mental health issues, and those people we really can't take care of.
Thank you so much. Thank you for taking the time.
Thank you
It's
for
been great
having us.
talking with you. Thank you.
Thank you.